part of the Sanibel community for many, many years. And what I'd like to do today is give you a very brief look at how the landscape of American healthcare has changed. And one of the reasons I used the word landscape is it's broad. It's very broad. It's not something you can look at and you have to turn your head. You have to look at all the different things that are going on and have going on. So a brief look at where we came from, where we are, and some ideas about where we're going. And then I'll talk also about how my practice fits into all this. So if we go back, let's try this. There we go. So 200 years ago and before in the United States, or it wasn't the United States, the first system that I'm aware of was Native Americans. And of course, the way that they dealt with illness or dis-ease was they observed how nature worked, and then they took what they learned and applied it to health. They used a great number of medicinal plants, minerals, and animal parts. And the people that delivered this health care were the medicine women, medicine men, shamans. And the medicine women in particular were the holders of the knowledge. Generation after generation, there would be this oral passing of all this knowledge about the various herbs. Unfortunately, in the late 1600s, this kind of backfired. The very patriarchal society, and this wasn't just Native Americans, because the women were practicing folk medicine and various, they were getting pretty popular. And this was one of the factors that led to the witch trials. These were women that had knowledge of how nature heals. And from certain perspectives, that's the devil's work. So they were persecuted badly. So during this time frame, there were a lot of elixirs, tonics, balms, snake oils, and liniments. They were the common medicines of the day. Some internally taken, some externally taken. The one main ingredient in most of them was alcohol. Which we still use that for medication today. And along with this system were many healing rituals, ceremonies, prayer, dance, art. So it was really a mind-body experience. The native people were aware that there were influences that were beyond the physical. So it was really, the early mind-body healing. And then if we look a little further, and massage was very big as well. In fact, it's likely that massage was the very first healing modality, because when something hurts, you just instinctively want to rub it. So it's quite likely that that was our first healing modality. In 1765, we start to see the influence of European medicine with the creation of the first American medical school at the College Academy and Charity School of Pennsylvania, which would later evolve into the University of Pennsylvania. And just after the formation of the medical school, Benjamin Franklin opened up the Pennsylvania Hospital. So they took this European model. These were models that were after the University of Edinburgh, which had a prominent medical school at the time. So Benjamin Franklin founded the Pennsylvania Hospital right near the medical school, so that they were able to do both the didactic learning as well as the hands-on clinical training. So now we'll take a look at some of our early practitioners. These are Navajo, and this was probably our first universal healthcare system. As you can see, there's the chief, and I think that's the opposition leader trying to hammer out some of the details of the Affordability Act back then. So they used medicinal herbs. These are Navajo medicine charts. So you can see the broad array of various herbs that they used medicinally. And this is the beginning of Western herbology. Using herbs for healing. Now, if we move a little bit further along, we get into the 1800s. And natural and home remedies, folk medicine, still very, very popular. Of course, most of the country was still very rural, excuse me. However, if you lived in New York or Philadelphia, you might have access to European-trained physicians. One of the common theories at that time was something called humorology, the study of body humors. There were 4 humors: blood, yellow bile, black bile, and phlegm. And when you were ill, it was said that your humors were out of order. So this is one, you've all heard of bloodletting. This is one of the reasons why bloodletting came in. Now, we had, it was a very different time, obviously, and much, whoops, pressed the wrong button. Much of the healthcare was delivered at home. There were traveling doctors, again, rural areas. These traveling doctors might only come through every few weeks in certain areas. So there we have our patients staying at home, and the multi-generational families living together. So you had grandparents raising the children. And when the grandparents became elderly, the children would take care. So it was a tremendous amount of in-home health care. And we start to see the derivation of pharmaceuticals, if you want to call them that. We had a limited number of plant-derived drugs, and I have a slide on that in a moment. Aspirin was discovered by Bayer at that time. That was the beginning of Bayer. Aspirin was revolutionary at the time. But it's interesting to note that if we discovered aspirin today, in all likelihood, it would not be approved as a drug because of the side effects that it has, bleeding and gastro problems. And Bayer now is kind of returning to their roots. They are investing millions and millions of dollars in China, trying to buy up property, trying to buy up pharmacies, because there are so many thousands of medicinal herbs in China that are working now when antibiotics are no longer working. So they're investing, they're trying to find out a way to become profitable working with Chinese herbs. So also we had barbers, were some of the early doctors or physicians in the United States. These barbers did crude surgeries, they did dentistry, they dispensed these medications. And midwifery, midwives, were a tremendous part of the healthcare system because they cared for women's reproductive health, which of course is a complex issue. So midwives and barbers were delivering a tremendous amount of healthcare back then. And so here we have non-physicians seeing more patients than physicians were. And of course it was low cost, self-pay, tremendous amount of barter. You got a cold, you brought a chicken to the doctor. You know, I don't do chicken, but maybe some pizza, that might work. And of course now we have the formation of the American Medical Association in 1847, and that's where we really start to see some changes in things. Interestingly enough though, the American Homeopathic Medical Association was founded 2 years early. They're not around anymore, unfortunately. I don't have it on the slide, but in this time period, we start to see the first inklings of Chinese medicine in America, coming with the Chinese immigrants that came to build the railroads. They came into California. Now, they pretty much kept the information to themselves, but it trickled out slowly. So here we see some images of some of the doctors that my grandparents, and maybe some of my parents in their early years, had health care like this. We see that being treated at home, and of course Norman Rockwell and another American painter. And they were going around. This was our health care back then. These were the drugs. Wonderful, wonderful drugs. So cocaine hydrochloride, very, very common, and this was stuff you could buy over the counter. Go to see your barber, get a shave, and a bottle of cocaine. Then we have cannabis, heroin. And then this one is just loaded with alcohol and all sorts of good things. And here we see Professor Mack's Miracle Elixir of Life, a cure-all. And it treats cramp, colic, headaches, you name it. There's about 50 different things listed here. Everything from chilblains, dyspepsia, tooth plaque. And it may be hard for you to see, you probably can't see it up there, but the bottom line says side effects may include death. So, some things have not changed. Okay? Now, we move forward into the 20th century, and again, this is a very accelerated process here with legislation. So, one of our biggest innovations or awarenesses in healthcare came with there we go again, pressing the wrong button, came with the, oh man, I went way far forward. I get my pointer and my clicker backwards. There we go. Okay. So, never a good thing. That's right. That's right. So, germ theory and hand washing. A particular doctor, and this is a sad story. In the mid-1800s, there was a European physician named Ignaz Semmelweis who observed that doctors were going from the morgue right to delivering babies. And he started investigating why is obstetrics lethal. And so he was the first one to hypothesize there was something on the hands that was causing illness. So he recommended hand washing. The backlash was fatal to him, literally. He was thrown out of the medical association. The doctors were insulted that they thought that they could be the cause of disease and death. So unfortunately, Semmelweis was put in asylum because he was crazy. The fact that he was seeing things, or invisible things on people's hands. And unfortunately, he died a very, very violent death as a result of that. He died in an institution. So it was only in the 1900s that Louis Pasteur and Joseph Listerine, and of course we know Pasteur, confirmed germ theory. And that was tremendous. This was the beginning of halting the spread of infectious disease. So a tremendous milestone. So then we move in and we start to see now the expanded number of pharmaceuticals, which was slow growth at the early part of the century, and now, of course, we have thousands and thousands of drugs. The polio vaccine was discovered. Smallpox was eradicated. To me, the early part of the 20th century was the golden age of Western medicine. It had a tremendous impact on our lives. The first vitamins were created. We realized that that large parts of the country, the soil was devoid of iodine. And in these areas, people would get huge goiters. So there was awareness now of what, vitamins and minerals, what effect they can have on our health. And that's when iodine started being added to our table salt. So then we begin to see the natural and home remedy usage start to decline in favor of this Western model of treatments. Now we still had, again, at the first half of the century, family doctors and self-pay. And even towards the latter part, I mean, I grew up, I started seeing a pediatrician until I was about 7. The next 17 years, I stayed with the same GP. I was admitted in the hospital, he came to the hospital. I mean, there was not this wide spectrum of specialization. And then, of course, we start to see technological advances. The X-ray machine is just one of them. MRIs, EKGs, blood tests. That's all, if you look at the big spectrum of healthcare, that's relatively new. And especially the X-ray machines. Did any of you, as you were growing up, go to a shoe store where they had the X-ray machine, you put your feet in? Yeah. Horribly dangerous, terribly dangerous. We'd never be able to do anything like that today. But that was so novel. You could put your feet in this machine and look, you could see your bones moving. So anyway, interesting stuff. So The last item I have here is the beginning of acupuncture and Chinese medicine in the mainstream here. In 1972, President Nixon and his famous trip to China, I believe it was the journalist that was covering for, it was a large newspaper at the time, and he came down with acute appendicitis and needed surgery. And they did surgery on him with no anesthesia, just acupuncture anesthesia. So, of course, he wrote about this, and America was amazed, you know, and of course quite skeptical at the time. But that was the first exposure that mainstream America had to Chinese medicine. In 1974, there was one of the pioneering acupuncturists in the country by the name of Miriam Lee. She was of Chinese descent. She was arrested in San Francisco for practicing acupuncture. And when she went to trial, literally hundreds and hundreds of people showed up in her support. And they gave testimony about her treatments and how it helped when nothing else would. So Governor Reagan was kind of forced to do something about that, and he granted her a special allowance to practice acupuncture as an experimental procedure. And this is an interesting thing that still goes on today. Here we have a medicine that was going on, treating millions and millions of people around the world, have been going on for thousands of years, but it comes to America, it's an experimental procedure. So anyway, eventually in 1976, Governor Jerry Brown legalized acupuncture in California. That was the first state to allow it. So moving right along. Conventional Western medicine today is practiced primarily by MDs and DOs. You have to have one of those licenses in order to do most of what's available now, as far as the Western standpoints go. Treatment principles are based on disease diagnosis, and the primary therapies, they're not a lot. Chemical agents, pharmaceuticals. Another word for that is chemotherapy. We think about chemotherapy in terms of cancer treatment. But every time you take a drug, you're taking a chemical for a therapeutic use, chemotherapy. And so, of course, surgery. Surgery, the technology in surgeries today is exceptional. And so Western medicine is excellent for acute care in the late stages of disease, and it's pretty ineffective at chronic disease and disease prevention. Technology plays such a huge role in our healthcare system, and unfortunately it's driven the costs up tremendously. It does, for the people that need it, it saves lives. But for the rest of us, we're paying for it in a lot of different ways. So the last thing on the slide here is the complicated insurance-based reimbursement system, and of course that's what we're mired in right now. So there's some of our wonder drugs. Personally, I wonder how effective they are, how safe they are, and how much they cost. But and the miraculous technology of the operating room of today. But you're looking at probably $1 million setup there, and that's probably conservative. And of course, all the paperwork. Now, much of this, of course, is becoming electronic, but the amount of administrative costs in Western medicine is unacceptable. So, as I mentioned earlier, Western medicine is not very good at dealing with chronic disease, and so we have an epidemic. Autoimmune diseases are being diagnosed at such an alarming rate now. So we're living longer, but we're spending the latter years sicker. It's interesting if you look at the demographics from the World Health Organization as far as how we line up against the developed world. And if you're, for newborns, we are about 17th in infant mortality, 17 out of 25 developed nations. Terrible at taking care of our babies. As you age, it gets better. If you're in your 40s, we're probably about 11th. But once you hit 80, we're number 3 in the world. So we do a great job of keeping people alive late in life. So childhood diseases, I find this extremely troubling. Children are getting sicker earlier and more serious. Childhood cancers rising exponentially. And of course, so much of this is involved with these factors. High stress levels, we're all working too much. Even our relaxation can be stressful, going out and partying and doing adventure sports and things like that. It may be fun, but it's not rest and relaxation. Poor quality food. We're going to talk a little bit more about that in a moment. Too much food. I don't believe that the human body was intended to have too much food. With less food, the body becomes much more efficient. Our metabolism speeds up. Our immune system actually is better when we're hungry. So that's a big, big issue. And again, too much food feeds cancers. If we have all of this extra nutrition in our body, these very, very hungry cancers are free to run rampant. Of course, we have a sedentary lifestyle. Many, many people have sleep issues. That's a tremendous, tremendous issue. Insomnia is very, very widespread. And of course, the cost of care. People aren't necessarily doing what they need to in order to prevent chronic disease. So, talking about food, this is a great photo essay that was in Time magazine in the last year. And what they do, this was more about cost, of what it costs to eat. I'm not going to talk about that right now. But if you look here at Italy, these are we'll go through a few of them here. You see a good amount of fresh vegetables and fresh made breads, pastas, fairly balanced diet. We've got some sodas back here and a few, the Kellogg's Frosty Chocos. Now, we look at Egypt. And this is in Cairo, so this is a more, middle class neighborhood. Again, look at all that produce. Wonderful. This is one of my favorites. Look at all that produce in Guatemala, an agrarian society. They're eating much, much healthier than we are. India, also vegetarian. Look at all that wonderful produce. Turkey, this is probably my favorite one. Nice assortment of all sorts of vegetables, grains, legumes, olives, and healthy breads. And the problem, a lot of people stay away from breads, and I understand that. Gluten insensitivity is obviously a big issue right now. Personally, I feel that it's less about the gluten and more about the fact that all of our grains are now genetically modified. And our bodies don't know what to do with that. Our immune systems, our digestive systems have never seen this stuff. And we'll talk more about that in a moment. So here we are in Atlanta. We've got pizza, we've got Taco Bell, KFC, McDonald's, Burger King, all of this stuff. There's a little bit of meat here, some grapes, and a cup of tomatoes. The rest of it. Look at all the sugar water here. All of the soda, juices, there's cases of soda, potato chips. And unfortunately, this is a pretty typical American diet now. It's kind of sad. It's very sad. So here in California, not much different. We do see a little bit more fruit back here. Of course, this wonderful produce out there. But again, look at all the boxes. Look at all the bright labels, packaging. All processed. Now, by contrast, I don't know if anybody else heard this growing up, but I did. Clean your plate because starving children in China, right? The children are starving in China. Well, guess what? Nowadays, they're eating pretty good. They're eating better than we are. They don't have very nice furniture, but again, it's a nicely balanced diet. So that's something that's a major, major factor in chronic disease is the poor quality of our food, and we're going to continue with that. Nowadays, our food really isn't food. It's loaded with artificial flavors and dyes, artificial sweeteners, some of which have been linked to cancer, and low levels of actually known carcinogens. The FDA allows a certain amount of cancer-causing products in your food. Preservatives as well, same thing. But I didn't put the Okay. Now, the other issue that I touched on is GMOs. Bioengineering, okay? So little of our food nowadays, you go to a supermarket, there's a very, very small percentage of that food, of what's sold there, that I actually consider food. So much of it is created first in a laboratory and then manufactured in a factory. No real intention of health there. There's unknown levels of safety. I could really do quite a talk on that. And then sugar. Oh, there we go. Backwards again. Sugar, major issue. So I'm already getting the sign here. So I'm going to skip through this. Real food doesn't have ingredients. Real food is ingredients. Never eat ingredients you can't pronounce. Except quinoa. You can eat quinoa. Drugstores. Here we are with the sugar. I find it fascinating that you have to walk past all of this to get your blood glucose testing supplies and diabetes management. Toxins in our environment. I could go on and on about this, but Roundup, folks, you need to educate yourselves about Roundup. We're all exposed to it now. The FDA and the EPA are just letting it, I mean, they're allowing it. And it's a very, very, very serious problem. It accelerates the growth of breast cancer cells, numerous issues. And I'm not going to get to all my material, but I'm going to be doing this in a full format probably here in January. There's two other things I want to mention. We're out of Roundup now. It's not working anymore. Agent Orange, familiar with that? Yeah. That's being sprayed, or is about to be sprayed on our crops now. Next 10 years, a lot of different predictions. Millions of people entering the system every year. In 10 years or so, 10,000 Americans will turn 65 every day. Then we got new viruses, Ebola, drug-resistant bacteria, they're a problem. Diabetes, autism, Alzheimer's, skyrocketing. So this is going to lead to fewer doctors per patient treating more illnesses. This will lead to an increase in concierge medicine. It could be a very good model for our community. Increase in home care thanks to technology. And Lisa, I'm sure, is much more knowledgeable about this. But the things that are being available now are becoming available in your home. That's really going to expand. And then a widening scope of physician's assistants, nurse practitioners, pharmacists, nurses, and complementary practitioners such as myself. I'm actually a primary care practitioner in the state of Florida, which means I can see people for colds, sprains, all sorts of things that you might go to the doctor for. So what you can do, prevention, number one, this is nothing new. The ounce of prevention versus a pound of cure. Well, prevention is not really popular as far as the mainstream goes because pounds of cure make a lot more money than ounces of prevention. So our high-quality diet, antioxidants, very, very important. Appropriate levels of exercise, stress management, sleep hygiene. You need to take care of yourself. Be your own primary care practitioner. You, more than anybody else in the world, has the greatest impact on your health. Unfortunately, too many people do not take self-responsibility. They wait till they're sick, then they go to the emergency room, they've got diabetes, they've got heart disease, and they expect other people to then pick up the tab. That's a huge problem, and that's one of the reasons that we're moving in the direction we are with the Healthcare Affordability Act, because it's swamping the system. People that are not taking care of themselves. So think ahead about where you're going to be in 10 years and prepare. If you're in a home that you think you're going to stay in, make sure it's prepared. Ramps, wheelchair accessibility, etc. And arrange for in-home care or living with family or something like that. Make sure your insurance policies cover in-home care. Because once we get into a facility, things decline quickly. So the longer you can stay in your home, the better off you are. And expand your horizons. Complementary and alternative medicine has been around for thousands and thousands of years. And that's where I come in. I'm just going to briefly go through this. Traditional Chinese medicine is what I practice. It's a form of primary health care used worldwide. It's been thousands of years. Acupuncture, Chinese medicine, Tuina, and it blends this is why I decided to go into Chinese medicine. It is, in the 1950s, it was reinvented in China to include Western medical knowledge. So we read blood tests, we read MRIs, we coordinate. I consider myself an integrated healthcare practitioner. I work with doctors, I refer to orthopedists. I don't believe in one side or the other. We choose the best therapies for the individual based on their needs. So, acupuncture and Chinese medicine commonly treats aches, pains, sprains, digestive orders, common cold and flu, all of these different things. Consider me before you run off to the doctor to get drugs. Acupuncture I'm going to do an acupuncture demonstration in a few minutes. Chinese herbal formulas. One of the main things that people are concerned about is the safety. I'm telling you right now that the Chinese have instituted new manufacturing guidelines in the last few years that are the top in the world. It used to be Australia. America's never been up there, as far as our manufacturing processes of drugs, etc. And I'll skip the rest of that. And there we are. There's one other thing that I want to mention, and I don't mean to be disparaging, but these are facts, and I call this the dirty little secret. The third leading cause of death in the United States, behind heart disease and cancer, is Western medicine. Two big things. Medical errors. And I've looked at all sorts of different numbers. You don't find this in the mainstream. It won't be published, except in the medical journals. And I don't think there's anybody read Lancet this week's no. Lancet, American Medical, the Journal of the American Medical Association, New England Journal of Medicine. They publish all these numbers. So, iatrogenic causes is the term for. It means physician-caused illness. So we're looking at 200, and these are conservative numbers as near as I can tell, 200,000 deaths every year from adverse drug reactions, and millions of people that are injured and sometimes hurt. Again, another 200,000 people dying from medical errors. Think about that. It works out to be about 300 people a day. Imagine if it was the airlines. You had 300 people dying in a plane crash every day. Would you go on a plane? No. And again, these are conservative numbers. There's an organization called Life Extension. If you've heard of them, they're an excellent organization that advocates natural health. They put a lot of scientific research behind the promotion of various supplements and natural therapies. They are probably on the more liberal end of their estimates, but they take information from the National Institute of Health, the World Health Organization, and get this, they estimate 1 million people, Americans, are dying from Western medical care every year. And again, I'm not making this up. You can look at the numbers. If you want to do the research, it's there. And they project that in 10 years, it's going to be 7.8 million deaths per year. And again, this is a big number. I don't know that that's necessarily true, but it gives you some idea of the scope. So, I'd like to thank you very much. I guess we're running a couple minutes late.